Even though 51% of the population will experience menopause, there's still very little reliable information or accessible care geared specifically for dealing with those symptoms. Today's guests have turned their own experiences with menopause into the business they wish they had access to.
You're listening to Found, TechCrunch's podcast that brings you the stories behind the startups. Today, we're talking to Monica Molinar and Anne Fullenwider, the founders and co-CEOs of Alloy Women's Health, a company that connects people experiencing menopause to dedicated doctors and resources. I'm Becca Skutak, and here to talk about how women and people with ovaries thrive in the second half of their life is my fabulous co-host,
Dominic Midori Davis. And before we get into our conversation, we have our two truths and a lie. At the end, we'll tell you which one of these statements isn't true, so listen carefully. Is a lie that Alloy Women's Health has worked with insurance companies from the beginning, that Anne and Monica had a full-blown founder meet-cute while walking their dogs, or that there is a significant lack of trained practitioners to address menopause adequately?
Listeners, you will have to keep listening to find out. Before you do, a quick reminder to rate and review the show. You can do so wherever you are already listening to this episode, so super easy on your end and very, very helpful on ours. Thank you in advance. And without further ado, here's our conversation with Monica and Anne. Hello, Anne. Hello, Monica. How are you both doing?
Hi, Becca. Doing great. Hi, Dominic.
Hi, both. It's Monica. I'm doing great also. So happy to be here.
Yes. And Monica, you did exactly what I was just about to ask you guys to do. So maybe if you guys want to start by each saying your name, just so our listeners can at least attempt to get an image in their mind and try to keep everything straight as we go through this, because we have both co-founders of Alloy Women's Health on today, which we don't always have both co-founders.
So I'm Anne Fullenwider, and we often get confused, Monica and I, even by people who know us well.
It's true. I'm Monica Molinar. I'm the other co-founder of Alloy Women's Health.
Oh, cool. Well, listeners, now that you've got that in your brains and you'll try to keep it straight through the next 40 minutes, but why don't you guys start by telling us a little bit about Alloy Women's Health?
Alloy Women's Health is a digital health platform for women in perimenopause and menopause who are sort of post-fertility, looking to not only navigate the medical and sort of biological transformation of this time of life, but also feel connected and informed and validated in what they're going through. So how do we do that? Very simply, we have a telehealth platform where women, first of all, they can be educated and informed about menopause and perimenopause and all the things that they might encounter at this stage of life, which are myriad and many, and most of us, at least going through it now, have come to it quite unprepared and uninformed. So we spend a lot of time and have spent the last 5 years really educating women about this stage of life and what you kind of can expect. And then we connect women directly with medical doctors who are trained with decades of experience in women's health and treating perimenopause and menopause and all of the other sort of associated and ancillary medical things that do come up for women in the course of their lives. And then we also actually offer access to the prescription treatments and the treatments that are proven effective and safe and are actually going to solve the problems. So it's a lot of things, but it's been really fun and super amazing to just connect with women our age all the time. And it stems from my own personal history of going into menopause at age 40 because I was diagnosed with the breast cancer gene. I have a very strong family history of breast and ovarian cancer. And so I was taking matters into my own hands to be proactive and prevent things that, I was at a super high risk to get, but discovered that nobody prepared me or informed me for the menopause that I was going into the very next day and for the rest of my life. And so that's sort of where this journey kind of began.
And you are leading into exactly what I was going to ask next. And Anne, definitely would love for you to weigh in here too. First of all, how did you guys meet? And sort of based on sort of the personal backgrounds and experiences you guys have had, why did it make sense for you guys to not only work to build Alloy, but to do it together?
So funny you asked us to differentiate ourselves by voice when we first started, because Monica basically came up to me. We were both walking really small puppies and looked very similar. And we actually had similar aged sons walking next to us, and we were wearing similar things. And she came up to me and said, "I think we should be friends." Because we looked like the same person, had similar haircuts, similar sunglasses, and really began a friendship there of kind of walking our dogs every morning together and talking about all the things that you get to talking to when you're on a long walk with someone who is quickly becoming a friend. And so that's really how we met. And that could have been it. But then we both were also kind of at transitional moments of our lives and careers. I had been editor-in-chief of Marie Claire at that point for 7 or 8 years, I think, and had been in magazines for 25 years and had some health issues going on in my family. My mother had recently passed away from a very sudden heart attack. My daughter was going through some health things. She's totally fine now. Monica had already been an entrepreneur and was thinking about what next, and had some health issues in her own family and her own experience of menopause, surgical menopause, overnight when she was 40. And so very quickly, after a few months of knowing each other and realizing we both were kind of looking for that next thing, Monica came and said to me, I think we should solve menopause. And the rest is sort of history, but it took a little bit. It took a minute.
There were some ups and downs in that journey, but our mission has always stayed true, actually, which is really to, one, figure out our own kind of path through menopause, but also serve women going through this as well and kind of workshopping our own lives while we help everybody else.
And when we really started to look into how do you solve menopause, we didn't really even know, even though Monica by that time had, gotten a protocol that was making her feel great and had gotten the care that she needed. It still took her 5 years and 5 doctors really to get there. And so when we looked into hey, what should we do? Why are so many women our age suffering from menopause? Why doesn't anyone know anything? Why is there this fear about estrogen? What's going on? We delved into it and we realized that there was sort of a study 20 years ago that put the sort of most effective, safe treatment on which there have been safety data for 80 years, kind of put it underground. And people weren't teaching it at medical schools anymore. And there was this real sort of, white space in entrepreneur speak, but sort of big giant hole in women's health. And there are a lot of those, but the one that was affecting us was really about perimenopause and menopause. We really realized that there's a huge expertise gap, and that if you weren't at least talking to women about estrogen at this time of their lives, then you were doing them a disservice. And so in trying to figure out how we were going to solve menopause and what kind of company we were going to start, we pretty quickly realized that we were going to have to start a telehealth company with pharmacy and doctors. And really, I think one of the biggest services that we do and biggest sort of gaps that we fill and biggest opportunity is that there's this, 55 to 85 million women in perimenopause or menopause in the US right now, and under 2,000 certified menopause practitioners. So we realized connecting women with that expertise and telling that story about what menopause is and what helps, connecting to that expertise is really what we wanted to do and what we've continued to do today.
Yeah, I was going to ask if menopause was one of those areas that is just woefully, there's not a lot of information about, because I wanted to know how you both went about, or the steps you guys took to kind of educate yourselves on this topic so that you could create products to help women.
It's unbelievable how little information there is about menopause in sort of the popular public knowledge. And even in the sort of the menopause societies around the world, have been kind of operating under this from a position more of fear for the last 20 years, kind of unnecessarily. So it's really been a process. First of all, it took me a long time to get it took me about 6 months after my surgery to get a prescription for menopausal hormone treatment. I honestly should have left the hospital with one, but I was told when you feel like you need it, you can have a prescription. And I think that's sort of the position that we put a lot of women into is you should definitely not treat yourself until you really, really believe that you're basically near death. And then, you can find a solution. And so basically what has happened is that women are looking, searching, kind of desperate, and even for information and for access to things that are actually going to make them feel better, which is why, people cycle through supplements and just there's all kinds of things that people are sold in order to, or antidepressants. Women our age are the highest cohort of antidepressant prescriptions being offered because doctors they're not trained in this. They don't know what to say. They don't want to have a conversation with women. It takes too long. And so it has definitely been a process of getting ourselves educated, even though, as I said, for myself, I knew after literally the first night of taking menopausal hormone treatment, I hadn't slept for 6 months. And the first night I took it, I slept through the night. And I've kind of never looked back. Although I definitely was in the swirl of sort of misinformation for a while as well. And I think the thing that we've really done in order to educate ourselves and make sure that we are kind of the most educated is have the best people around us. So really fantastic doctors who are as passionate as we are about serving women in this life stage and sort of giving them access to the best care and treatment. We've been able to sort of figure out a way to offer this and democratize this access to care for everybody, regardless of whether you have insurance, regardless of whether you work for a company that offers this care. It's affordable and easy to access, convenient, and sort of really answers your questions and gets you what you need. And we believe that women have sort of been prevented in so many areas from getting proper care and treatment, in particular post-fertility, that it's great that there are just multiple options for them to get care at this point.
And I did want to ask you guys about building the company, because what you just mentioned, the access piece, where you don't need insurance to use sort of access the care that you guys are giving. And I noticed I was reading the Fortune piece about you guys and tied to your recent funding announcement earlier this week. And they were mentioning that you guys chose not to work with insurance, or at least the way it was written, it seems like intentionally. So I was definitely curious if you guys could talk about that piece of it and sort of why that decision made the most sense for you guys, as well as maybe some other things that went into being really intentional about how you guys built this business.
So going back to the fact that what was really, really missing is this connection to expert care. And again, like very, very few doctors with the training and so many women with menopause. We really wanted to build something that worked for the doctors in order to be able to get the doctors in direct touch with the customers. And believe it or not, in creating that and trying to build that direct pipeline, we found more often than not that insurance is a barrier to care. For some people, but the minority of people for whom all of the systems has lined up to be perfect, right? Like, so you've got a doctor who understands menopause. They can see you sometime soon. They give you the right advice. You get that advice and that prescription sent to the right pharmacy. That pharmacy actually gives it to you. And that is all covered by your insurance. There's sort of three hurdles. There's like doctors aren't trained.
Right.
Then there are pharmacists who actively say, we can't give this to you because it will cause breast cancer, which is,
happened to me.
Not true. Absolutely not true. Yeah. And then there are the insurers who, basically the whole system, and you guys probably know this from lots of other conversations and the whole world knows this, but like the medical system the healthcare system is really, the incentives are so misaligned. And that's been going on in such extremes for so long now that it's completely broken down. And particularly for women across variant, right? We're not even studied in clinical trials. And they say, a lot of people will say, women's bodies were not inserted in clinical trials until 1994. But the fact is, even since then, very few of us have actually been into these clinical trials. So the sort of medical science is based on men's bodies. Then you get to the fact that if they're focusing on women, it's mostly about reproduction. And then you get to the fact that we're sort of like the menopausal woman is like old and sort of, no longer useful in terms of like creating babies. So we're really at the bottom of the pile in sort of all the resources. Like less than, I think, 11% of federal research money goes to, of all of the federal research money directed at medical research of the funding, only like less than 11% of it is just for women's bodies. That's just one of the many pieces of the puzzle that is not aligned to get women direct help from experts who can. And also, by the way, the doctors are not incentivized to counsel. They're incentivized for lots of other things, including delivering babies, which is what most OBGYNs went into this practice for. So in sort of knocking down all the hurdles and trying to create a direct channel between the doctor and the patient, we just wanted to eliminate all of the barriers. And in fact, insurance is still operating, most of them, on the older science. They will not give you certain things. They will cut you off after a certain amount of time, all of which is based on this old science from the study that happened 20 years ago. And so really, there are people out there building new health companies to fit into the old system. And in the end, we believe that's the wrong direction because that system is still broken and the incentives are still misaligned. And so what we found was the most useful thing to do was actually just create our own lane and go over here and actually get women the help, the care, the solutions that they need without any other people in between us and them. Because if you build a company geared towards insurance, the insurance people are actually your customers, whereas our customer and our sole attention is on the woman experiencing menopause and what we can do to get her the best help the soonest so that she can get on with her life and actually not think about menopause anymore.
And also essentially for a $50 yearly fee to have unlimited access to ask whatever questions about your treatment to the doctor or, you would need a dose change or whatever. There's a lot of flexibility that we've built into that to enable this sort of longitudinal relationship with a doctor that has kind of fallen out of the system as it is today. And we launched in 50 states. We continue to serve women all across the country. And we felt that it was really important to be able to be national from the first day.
And I also wanted to ask you a little bit about thinking about the model you guys have taken. On one side, having that sort of affordable yearly price makes fitting into scale seem easier. Like it's easy to scale if this is super accessible, especially on the price side. But because there is such limited amount of providers, clinicians trained in this area, how do you guys think about scale? Price obviously is a factor, but supply is also a factor, and supply is kind of interesting in this space compared to others in the medical field. So how do you guys think about that and being able to scale and make sure that as you guys get bigger, newer users still get the same kind of experience as probably these early adopters have been able to get?
So this is exactly our secret sauce. And so what we have built is a back-end technology by which we can connect the doctors and the patients completely asynchronously. So it's all messaging, as it's all through a secure portal. And that means women who you have, again, like Monica said, you can message the doctor at any time with any question you have at any point, like in the middle of the night or 2 weeks after you had the initial appointment. And also doctors love it because they can answer they can do it on their own time. We have a great system where the doctors actually have their own Slack channel. They have office hours and they can kind of collaborate, build community around just the medical team. And they are constantly in touch with their patients in a way that makes a lot more sense for them. And they love it. So we've had zero doctor attrition. We've had doctors come to us at conferences and say, can I join the team? I've heard Alloy is really great. It means that we still have not even reached the capacity of the doctors we have now. And we have sort of a seemingly endless supply of doctors wanting to work with us because more and more, it's really, really difficult to be a doctor right now. And we've set up a way to do it that doctors seem to really like. And, many of them have multi-state licenses, so they can scale it. And they are not incentivized to prescribe. They're incentivized to review medical intake forms and to make recommendations, create treatment plans, and then also to keep patients under care for long, because this is going to be the rest of your life. You may have this relationship for a very long time and have different symptoms that pop up at different times and need adjustments or further help. So the scale piece actually is what we're best built for. And I think doing this asynchronously has been a win-win-win actually for all involved.
Yeah. And also, I think because our culture is so strong from within our own business and sort of the team, not only are the doctors not leaving, they're actually really leaning in more and bringing people along with them. They're having sort of a collaborative workplace that they've never actually had before, most of them, even working in practices where they can ask questions or sort of get advice if they need. Women have complicated health histories, so while to a degree, menopause is actually quite simple. Your ovaries have stopped making estrogen. So you sort of fall off a hormonal cliff for many people quite suddenly, and it causes a lot of problems. What's really sort of sometimes makes it more complicated is just by the time you're 50, you've had lots of things in your life come up, so everybody has their own individual story and wants to speak with a doctor and be heard and validated and given really sort of individual and personalized advice. And that's what we were able to do in a very affordable way and really think about what are the problems that we're trying to solve for whom? So whether it's our patients or not our customers, the doctor's patients, or the doctors or our team, or, we can be really deliberate about sort of how we're moving forward in the world and with the business to just sort of maximize outcomes for everybody.
More from this conversation right after a quick break.
I know that women's health overall has been under the spotlight recently, especially since the overturn of Dobbs. But I know that a lot of women's health companies have spoken about how there's been an increase in venture funding also because of the political landscape. I wanted to ask you guys if you see the political landscape impacting your company, and especially as a new administration comes in, and especially as women's health is still under a microscope.
I think there's so many parts of women's health that certainly will be under a microscope and will be very much affected by the new administration, for better or for worse. Menopause is still not really on anyone's radar, and it's not controversial in that the treatment is universal, and every woman or every person born with ovaries will go through it. And the reason we weren't getting attention before is because people we're like last on the list, and it's the same reason that we're not that worried about the changing and certainly worrisome changing landscape. But just menopause is not. Partly, I think it's because it's not related to reproduction. It just isn't like a topic that gets people fired up, for better or for worse. And in many cases, that's not good. But for this particular piece of it, it is.
Hopefully.
No, that is so interesting. But yeah, I feel like I would have assumed you would have said it would play a big role. But now that you bring it up, it's like, well, if everyone was for it,
nobody
which
cares.
is not good. But that's nothing.
I mean, that's part of
the things that we've heard, from the very beginning of this to isn't that kind of niche? Like that thing that 51% of the population will definitely go through and has not been treated well. Or just the menopause is wow, there's so many menopause companies. And we were there are so many more fertility companies. menopause is still very underserved. And even though there's so many of us out here, the latest stats we heard at the Menopause Society earlier this year is that like less than 2% of all women are getting HRT, and it's less than half of 1% of Black women are being prescribed HRT. So there's just like a real need, and I think we'll be able to continue to serve it.
But also from a public health standpoint, from a health cost standpoint, from a quality of life standpoint, I mean, now is the time for women to treat themselves to avoid all of the massive kind of chronic diseases that can come up, like osteoporosis, which affects half of women and all women, and estrogen is FDA approved to prevent. So if we could even just prevent fractures among women and keep those women out of the hospital, out of nursing homes, prevent their family members from having to take care of them, even just that alone would be enough. And of course, the improvement in their quality of life and how they feel and how they're actually moving, through the world for the second half of their lives is really what we're focused on.
Definitely. And you just brought up sort of investor feedback, which I definitely wanted to ask you guys about. I know you just successfully raised another round that was announced earlier this week. But if you want to talk about funding and sort of a caveat to that question, also from the really nice Fortune piece earlier this week, I know it mentioned that you guys talked about growing this slow and steady, which slow and steady is generally like the antithesis of everything a venture capitalist wants. So adding that in as a wrinkle too, what was it like fundraising for this company based on sort of the area you guys are building, based on the growing competition in the space, and as well as the approach you're taking too?
Yeah, I think that slow and steady weren't our words. And we absolutely love the reporting. We did great. We love the story. We're so great. But what I think it is we have been careful. And we started this company in an environment where people are still throwing money around. And there was there's sort of just spend a ton of money to grow really fast. And that's totally going to work. And then I think 18 months into, certainly 3 months into starting Alloy, the pandemic hit. And then sort of the market changed. And there was a whole different sensibility from investors and from everybody. Like, actually, when are you going to be profitable? And so in many ways, that was like a shock. And at the same time, it was extremely helpful in that it really focused us. And we just had to think about getting through the pandemic and getting to profitability in the most lean way possible. And in fact, was really helpful. So I think we happened to have sort of come up as a company during a time when profitability we were asked about it for 18 months straight, like when are you profitable. And I don't think that was the environment at all. Certainly when I left my job at Marie Claire to do this, I thought it was a much more fast and loose and throwing money around kind of environment, but it's been great. I mean, it really has trained our minds on building the business. It's been very easy to focus on things. That said, when I was at Marie Claire, we launched a conference for female founders and female funders. So I had heard a ton of stories about how hard it is to get funding. And that's certainly a dominant narrative. And it's still true that, I forget, like less than 10% of women or female founder companies are getting venture funds. I think it's getting a little better, but then there was a year that it actually got worse. So I think, yes, it's hard for women to raise money in general. And it was hard to think about raising money for women's health, for women's menopausal health. It was not like the sexiest thing to be bringing to a Zoom room full of VCs. But I think we did happen to find really early on, Ankur Jain and Alex Fiance at Kairos HQ were like, we've been looking for a menopause company. And they really saw the opportunity that we saw. Did we have a ton of meetings with people who didn't get it? Absolutely. We had a lawyer who once said, but this has never been done before. And we were like, that's why we're doing it.
That's the point.
As if that was like a negative. We're like, it's called white space. And also we know what this woman wants because we are her. Also, we were able to prove traction pretty early on. And once you have traction and a good idea and proof of concept and proof that it's working, the conversation totally changes. It doesn't even really matter what you're working on as long as you have good unit economics and the numbers are adding up and it's working, then all of a sudden people want to come in.
Speaking of, I know both of you have very different backgrounds from each other. And I know, Monica, you were an entrepreneur before, but in a very different space than, say, a health tech company. Yeah. And you have this career in magazine publishing, which is someone who works in publishing. Technically, I'm like, I don't know how I would start a startup. So I'm definitely curious how you guys think about how your backgrounds, career-wise, have played a role in the growing of this company. Are there things you were able to bring over that you were like, this worked last time, or I found that this leadership style worked when I was at XYZ? Or do you think there hasn't been as much overlap as you were anticipating? Just what is it like switching from those types of environments into building something like this?
For me, for sure, this is sort of like bringing together all 50 years of experience that I have so far on this earth, and all the networks and all of my passion and everything has kind of coalesced into this, which has been really phenomenal. My career path before I had my ovaries out was quite up and down and sort of didn't really follow a linear path. I had never really found my passion, and I worked for pretty inflexible companies, and I had small children, and I had like a sort of kink in my caregiving for my kids and had no flexibility to sort of keep working and find new care. So I ended up leaving my job for a few years, and between ages 30 and 40 was kind of in and out of the workforce multiple times. And I worked part-time, full-time, not at all. So I always sort of knew what I was missing, but my family always came first. Also because of the demands of my husband's job and his travel and stuff. That's just sort of the decisions that I had to make. But when I was 40 and I had my ovaries out and I knew I wasn't having more kids, and I was kind of like, okay, well, I went to business school, I could have had a career, like, what am I going to do with myself? And I had a bit of a crisis moment and then decided to take that energy and turn it into like, all right, I'm going to reinvent, I'm going to actually create the thing that I want to do and sort of create the experience that I need to get a job. And if I can't get a job, then I'll do it myself, and I'll sort of get myself to the place where at least I have enough experience where I can get a job that feels right for me. And so that is sort of what led me to start Seed and Mill, which was my first business in the food space. I started with 2 partners in a shop in Chelsea Market in New York City, and I learned so much. I mean, it was really unbelievable, and I definitely would not have been able to do the job that I'm doing at Alloy without having had that experience, both just, how to literally call people and say, like, here's what I'm doing and this is what I need, and, get people to help you and find money and just roll up your sleeves and kind of do something and kind of get it done. PR, like all the things that I had done up until that point, I really brought into that job. And then everything that I did in that job and that business, I feel like, and also being a mother and a working mother and sort of taking all the things that we've learned up until this point and trying to infuse our company culture with the things that we also want and need as working mothers ourselves, as professionals ourselves. We built an entirely remote company and culture, which has also been really interesting and sort of works for lots of people and different types of people and from all over the world at this point. So that's been super interesting. I think being a kind of a middle-aged entrepreneur is actually really the way to do it, because you have so much to draw on, so many experiences, that it just like our networks together, there's sort of nobody in the world between us who we can't reach. And that's been really fun.
And magazines, I think, I felt like, oh, we've covered entrepreneurs. I really know this space really well. And then completely had no idea. At various stages of my career, I think I've jumped into things not knowing exactly what I was getting into, thinking I had more of an idea than I did. I think a couple of things directly from magazines is one of the things that we've been starting to cover women's health. And one of the stories that we did was called Being a Woman is Killing You, because of all the lack of research in women's health. And so I really, in learning more about that through the magazine, I really sort of, that plus what was going on in my own family, I sort of started to think about, well, like, actually, it's been great to learn about all this stuff, but now I kind of want to roll up my sleeves and jump in and help in a more hands-on way. And, we've been doing tons of great journalism at Marie Claire and my prior jobs at Vanity Fair and elsewhere. But especially in fashion and beauty, I had sort of felt like I was maybe helping women from the outside in, and I really wanted to focus now on the inside out. And that was like a real sort of pivot for me. And then, yes, running a magazine, running an international brand and telling stories and making sure that we connect with women in a way that they understand is something I've been able to bring. And I think in many ways that was sort of like menopause had a PR problem and continues to, but like I think retelling a story and connecting with women and making it emotional and real, and also like representation. Like people think of menopause when they think about their grandmother. I think just showing up and being like, no, this is what a 50-year-old woman looks like, and this is how you can live the rest of your life, and it can be like the best time of your life, is also something I kind of learned a little bit in my prior lives.
I think also one thing, we heard a story today about a 31-year-old woman who went through menopause. And I think part of just having these conversations and speaking to women your age and of all ages before they're in menopause is like, sometimes you're not 51. You could be 30. You could be 37. You could, and so being aware that this is even something that you might go through and hear some of the symptoms and not being afraid of it and understanding what the solutions are is so important to all of us and, all generations of women going forward, that just really we've been disserved, and the information is there. It's very clear. The science is sound. We have decades of data on treatments and solutions, and still we tell women, no, you can't have this. And we don't ask for their input or agency or, like, what do you need? What are you looking for? And I think that is the conversation that we're really trying to have with women. It's important that you take care of yourself. It's important that you take care of yourself now at this time, because if you don't take care of yourself now, in 10 years from now, you will have other health things that have come up that you probably could have prevented, but you can't once you have it. And so, really sort of for all people to understand the different phases of sort of our biological journeys, I think is really critical, and something that for whatever reason, like women we haven't heard before. And so now the secret's out of the bag, and the response that we've gotten from women, and the thank you, you've saved my life. I'm back to myself. I didn't get divorced. I was on the path to divorce and it didn't happen. All those things are very real, and that real impact that we can have on women's lives just by listening to them and connecting them with somebody who can help them and giving them the solutions is really profound.
And something I definitely wanted to touch on was the fact that you are both co-CEOs. I kind of love asking co-founders this. How did you decide, I guess for you both, how did you decide to split responsibilities rather than, one CEO and someone has another executive role?
It's funny, I don't even remember making the decision that we would be co-CEOs, but I think it's worked out really well, partly because maybe I think at this age, you kind of have a way of like removing your ego in some ways from like being defined by exactly what you're doing at your work. So I think we've been able to split it. It also very naturally, we kind of come from opposites, right? Like I come from climbing the corporate ladder in a certain industry, and Monica comes from a much more like creative, and even though like business doesn't always sound like it's creative, but creating a business before this is really creative. I think we've been able to mesh working styles and brain styles. And the other piece is that Monica came to menopause surgically overnight, was patient zero, as I call her. And like really, I used to call her also the canary in the coal mine before I entered this myself. And I entered it completely naturally, which is just mean gradually, in the way that the majority of women slowly start to lose their estrogen. And so we also have very different experiences of menopause. So what we kind of figured out was like, okay, magazine editor, like external facing, get sort of more marketing, and Monica patient zero, think about patient care and doctors and offering and like what the patient experience, so to speak, is like. And so it's been a very natural division. We do sort of dovetail a little bit, but we're also on different continents. So Monica moved to the Netherlands right in 2020 when we had started to talk about this and work on it. Yeah. And luckily that works really well. But and I have read actually that it's that like women generally are better at being co-CEOs than men. And I think it's because we're just, I don't know, used to the back and forth. I don't know.
I think having started another business before also, and now being an entrepreneur for the last 10 years, I know that for myself, first of all, I like and need the discipline of having somebody to be responsible to, and also it's really important to have that feedback for me of like, is this a good idea? Is this not a good idea? Let's do, and just sort of the camaraderie of it. It can be very lonely doing this. We have really been heads down for 5 years, almost, I think we met 6 or 7 years ago, talking about this, doing this. It's very singular minded. So to not have somebody to share that with is hard.
Have someone like to be like tunneling through the jungle with.
Yeah. And the great thing about Anne and I is that we actually did start out, we didn't know each other very well. We weren't great friends, but we were friendly and we sort of knew that we liked each other up front. The funny thing is that we have like very similar and big networks of people, but they kind of like go alongside each other. They kind of know each other, but so we really expand each other's worlds also, which is very nice. And it's really important to trust and respect your co-founder. Without that, I think, it would be impossible. But the fact that we do have such a nice relationship with one another and we do sort of value and trust and respect the other's opinion has been, I think, probably the most important thing for our company culture. When it really comes down to it, like the way that we interact with one another and how we see the world, and whether it's conflict resolution or although we don't even have that much conflict, but there are lots of things that come up. So how do you get through that together is, I think, what we really do very, very well and really enjoy and have kind of infused in our team as well.
And I know we're almost out of time, but I also have to ask this question, which is, what is the funniest, craziest, wildest story you both have about running this company and trying to get it off the ground?
So many. There's the time that we landed in LA to host a cocktails and conversation we've been doing these sort of like, we joke that they're like Tupperware parties, but like kitchen conversations about menopause and sort of a grassroots effort to get the word out. So we were really excited. We were on some high. Something good had just happened because this is the way it always works. We got to LA. We're getting ready. We woke up at like 7 a.m. on a Monday because Monica's in European time. I'm in New York time, and we're on the West Coast. And to this note from the CEO of our back end partner, who like was also a startup, and they had sort of been the architecture of like our electronic medical records and a few other things. But we got this note on Monday saying, as we're like going out to like host a party, so we're going under, you have 7 days. No, you have until Friday to get all of your data off of our servers. Sorry, good luck. And we were like, oh my God. So then we like called our 4-engineer team, I think, and we're like, can we do this? And it was one of the most outrageous requests we've ever made to it was just like, what the hell are we going to do? And by the way, we have to go like cheerfully host a party for 50 women right now. We don't even know if we're going to be in business in 5 days. And it was a really rallying point for the whole team. It turned out to be like
the best thing ever.
I wouldn't necessarily say it was the best thing, but the fact that our engineer team rallied, we hired a few extra resources, we talked them into giving us more than a week. I think we had a month to get stuff off the server, and then we had to build the whole back-end tech ourselves, which is just much better for our business. So we own much more of our tech, but also, we all devotedly love our engineering team. And it was a real bonding experience to sort of go through this crisis together. But it really was one of those moments where we could have easily collapsed as a company at that moment. But there are others. I mean,
they always seem to come like the best day is also the worst day. I don't know why, but as Anne alluded to it before, like it always works like that. Like there's always something that's like, if something fantastic happens, there has to be a counterweight because I don't know, that's startup life.
Definitely.
But you just get through it. I mean, and part of the thing I think is at this point, there are so many thousands upon thousands of people that are depending on us that we really feel responsible to and devoted to and have a relationship with and don't want to let down. And this is such important care, and it's so important to innovate in healthcare so that it can be sustainable. Like this isn't something that should just be a flash in the pan and then you're done. Like every day, there are thousands and thousands of women who are entering menopause and looking for a solution. So we are here for them.
Definitely. Well, I think that's a nice note to end on. So thank you so much, Monica and Anne, for coming on the show. This has been great.
Thank you.
Thanks so much, guys. It's really nice to meet you both.
And that was our conversation with Anne and Monica. Tom, what was the lie?
That Ally Women's Health has worked with insurance companies from the very beginning. They don't work with insurance companies.
Yeah, this is something I thought was interesting because I feel like every time we have had a health tech company on, especially one focused on these areas of women's health that are less explored, like menopause, or when we had the hormonal health company on as well, they were like, oh, we went to insurance first. Like, we want to make sure it's affordable. We want to make sure it has all this access. And they were like, well, we're doing essentially the opposite to also get widespread access, which in their defense, their pricing is pretty inexpensive. So some people definitely say that, and then you look at their pricing and you're like, who is this accessible for? But like, this is definitely on the more accessible end, I would say. But I definitely think that's kind of interesting.
Yeah, I'm trying to figure out if that's a good thing or a bad thing in terms of people deciding to use the product. Because maybe, I mean, people see insurance as kind of like my insurance covers it, I can do it type of mentality.
Right.
Whereas like if something's not covered by insurance, you're kind of like, I don't know, insurance doesn't cover that. How much is the extra cost out of pocket?
Right. Yeah, I mean, you'll very rarely hear me say something positive about the insurance industry, especially the medical insurance industry. But it's a huge part of the healthcare system here in the US, like whether we like that or not. And like, I do wonder if everyone uses a service like this, which of course would obviously be great for the founders of Alloy, but like if everyone uses a service like this, that's going to tell insurance companies, that's not going to give them the data that people are craving this information necessarily. And that may have some kind of a ripple effect that way. And of course, again, I don't know anything about the insurance industry, but they follow dollars and cents. And if it doesn't seem like people are using them to access this kind of care, it's not going to rise in prominence to them.
Yeah, I know. Especially because, yeah, you're right. Insurance is such a big, insurance is like the whole industry of medical care here. I mean, if you're not employed and you don't have it, or, even like the Affordable Care Act, there's so many things. Access to medical care is so important, especially now with women's health under the spotlight. I mean, like, that's the one thing I was thinking about was like, I guess in a sense, this is a good way to kind of privately buy something for women's health that won't put you on the radar of a lot of things or anything. And so I can see where that's kind of a good thing, especially when there are states trying to like ban, shipping certain things into the state. This is kind of a good way to kind of, I guess, go around it. But yeah, the insurance thing is a big question.
And I get their point too, like not only the accessibility piece, but also like if you build a company that is reliant on insurance, the insurance companies are your customers, not the actual users, which is so true. And someone recently was telling me that technically when you throw a conference or an event, your customers are the sponsors. They're not the actual attendees, because without them, it doesn't happen. And so that's definitely a true way to think about it. Also, I thought the interesting piece of this too, the business model and the fact that choosing to do it this way, I originally was like, oh, is that going to be hard to bring doctors on? But it sounds like they've had literally the exact opposite experience where it's like doctors prefer to go around insurance as well and like prefer to be able to work in this kind of environment. And the fact that they said they've had like no churn with doctors is crazy.
I mean, yeah. Insurance companies, maybe they're the problem. I remember my dentist and the insurance company fighting over $1. And I was like, y'all better work it out because I'm not paying that $1. I was like, you better like figure that out. Yeah, maybe insurance is the problem. Yeah, I can imagine doctors don't want to deal with the headache of insurance and paperwork. And I remember when I was a kid, they were like, oh yeah, you need all of this work done. And then they started doing it. And then they were like, wait, I actually have to see if this is covered by your insurance. And I was like, are you going to let me just like, what is this?
Right.
So, I mean, I imagine doctors are kind of like, finally, I can just kind of do what I want and help people in the ways that I want without dealing with insurance companies.
No, that's so true. I've watched this happen to multiple friends and family members where it's like their doctor is like, this is the perfect solution to your problem. Like, this is going to work super well. And then the insurance company is like, oh, did we forget I was also here? Like, no. You just can't.
No.
And it's just like...
It's a SpongeBob episode.
Like, literally. Like
you saw that SpongeBob episode, right?
I think I know what you're talking about.
Where Mr. Krabs is in the hospital and they were like, we need to treat him immediately. He didn't have insurance, so they like rolled him down a hill.
They kicked him down a hill,
like, get him out of here. That's awful.
No, it really, I mean, that says everything. Like, we grew up watching kids shows that made jokes about how bad the insurance market was here. So, like, maybe they are smart for not doing it. I just think it's so interesting because it's like the first company we've talked to that's like taking that stance. And you always, like, everyone is going to the yin side, they're going to the yang.
Yeah.
Maybe that's a good way to differentiate themselves. Because that was another piece we talked about a little bit with them that I know you and I have talked about on past episodes. This category has gotten so much interest over the last couple of years, and Alloy is, of course, not the only company out there focused on helping women get this care and people who go through menopause in general get this care. And maybe this gives people options because, of course, the market's huge. So it's not bad there's multiple players, but maybe making these kind of choices allows them to stand out in these different ways when people, the vast, huge population that needs this care, is deciding kind of like what they want to do.
Yeah. And you know what else is like, every time I think about companies like this, I'm just like baffled how the women's health, how there's just no information on it.
I know. I love hearing that every time. And I'm like, cool. Well, hopefully like I have perfect health forever and never have to look into it, I guess. Which is not realistic.
I know me doing insurance this morning, I was just like, will I fall anytime soon? Yes, Do I need fall?
I was like, I don't know if I'm going to commit an accident this year. Like, I don't know.
They're like, do you need long-term hospital stay? I'm like, maybe I'll just be really careful next year. I don't know. But the lack of information on menopause is just, I mean, it's not surprising, but it's also just like half the country is going to go through it, more than half the country.
Literally.
The fact that, does it make people uncomfortable? Is it like awkward to talk about?
It must be, but it's also just like, who cares? Like, you have to have those kind of, I mean, you know this, of course, but it's like, you have to have these kind of conversations sometimes. Like, they're very important. It drastically changes people's lives. And I know even just from like the couple companies I've spoken to in this space, like women talking about when they hit this period of their life and they just stop sleeping at all. I'm like, just that alone, say no more. I'd go insane.
Yeah, I've heard some things that I'm not ready for, but maybe that's what this company is for.
Exactly. Helping you kind of navigate those things that all sound quite awful. Found is hosted by myself, TechCrunch senior reporter Becca Skutak, alongside senior reporter Dominic Midori Davis. Found is produced by Maggie Stamets with editing by Kel. Our illustrator is Bryce Durbin. Found's audience development and social media is managed by Morgan Little, Alyssa Stringer, and Natalie Kreisman. TechCrunch's audio products are managed by Henry Pickavet. Thanks for listening, and we'll be back next week.